Dr. Kim Grützmacher. Thank you again, Kim, for co-hosting this with us today. Senior Advisor on One Health, Biodiversity and Health with GIZ, and also one of the leaders of the International Alliance Against Health Risks in Wildlife Trade, which we are also members of and very happy to be part of. Kim, tell us a little bit more about the work that you are doing in the Alliance to address to prevent pandemics at the source. Just push it up and there you go.
Perfect. Thank you so much, Nigel. Well, this is really hard to follow, so I mean, all of what's been said already, and I really appreciate it because you can tell that, you know, there are individuals, people sitting here who really, not only do they know what they're talking about, but they really speak from their hearts and really have been thinking about this for a very long time, have been in this for a really long time. So it's not just, you know, talking points as you probably have noticed. So I'm absolutely humbled to share a panel with such amazing women, and not just sorry.
Just forget about
And I'm very happy to have the opportunity to speak to you a little bit about the International Alliance, and maybe this will help at this point to make some of this conversation a bit more concrete and talk about a very specific project, and also maybe elaborate a little bit on the rationale behind why we do have the focus that we have on wildlife trade and the scope of that, and where opportunities and entry points are, but of course also where there's still so much that we need to learn, and we do need to learn a lot. It's a process, it's a learning process for sure. So as I mentioned earlier, so the International Alliance Against Health Risk and Wildlife Trade was launched in September 2001 at the World Conservation Congress in Marseille. And we've been bringing together different stakeholders who are interested in this sphere and basically are interested in joining forces to help reduce the risk of emerging infectious diseases from wildlife trade and consumption to prevent future pandemics, but not just that, it goes beyond that. It's not just all about pandemics, which are still, even though they are increasing, relatively rare events, but there's many steps along the way. There are spillover events, outbreaks, epidemics, and so forth, lots of suffering involved. It's not every spillover will have to lead to a pandemic to cause a lot of suffering along the way. So this is what we are addressing, and we brought together very different stakeholders who come at it from different sides. So let's say, for instance, the conservation community has a lot of experience around wildlife trade. There's a lot of knowledge, illegal wildlife trade, but also, of course, we do look at the legal side of wildlife trade as well, which in volume is even greater. And for the pathogens, it does not really matter if it's an animal that's being traded or consumed legally or illegally. So we do address the entire scope of it. So legally traded, illegally traded, wild caught, bred, etc., etc. So the entire scope. Because so we are very focused on the topic of wildlife trade and health risks from that, but that still is actually a pretty huge scope. And we are incredibly grateful to have such amazing partners with who we can work, because as you will hear later, the Pre-Zone initiative is a great partner, and we work well together, and there is a lot of alignment. And of course, preventing pandemics at the source, there are many actors in the field with similar interests, and it's fantastic to join forces. So, and then of course we have the health actors, and as Christina has pointed out, there isn't a lot of common language yet. So, and part of the work of the International Alliance, or us as Secretariat at the moment, is to help facilitate the dialogue, help translate, help find a common language, define define terms and find joint strategy. So we did that. So we spent more than 6 months bringing the initially interested parties together, defining a scope and a focus, working on finding a common language, defining our joint interests, and also really getting to know each other. So currently we have more than 100 members that are, so we're still working to get the WHO on board, but the World Organization of Animal Health is on board. Yes. We do have some indigenous community leaders, and Nicole has been very, very patient and very helpful for us, also teaching us some of the things that she has said here, and it's also a very humbling and very helpful process to learn all the ways in which we can definitely benefit from challenging our own way of thinking and approaching these issues. So we're very grateful for your guidance. Yes, so we do also, so the German contribution to the International Alliance funding more than 15 projects currently. So, and it has a huge scope. We look at projects that look into knowledge, attitude, and practices around wildlife trade and consumption, to value-based behavioral change initiatives with Buddhist communities in Asia, for instance. So there's a broad scope, and the goal is to take that knowledge that we're currently generating through these projects and working with diverse groups of people, bring that back into the alliance and talk about it. Discuss what we have, because there are still many knowledge gaps, and as you might be aware, particularly when it comes to exact spillover mechanisms, etc., there's still a lot that we don't know, but we know enough to act. It's definitely enough knowledge there when we do look at various pathogens and what happened in the past, and outbreaks and epidemics and pandemics, and we do look at the trends. It's pretty clear, and also of course livestock does play a role quite often, but the origins are, as you would know, in the majority of cases found in wildlife. So the contact that we do have with wildlife, and we have to consider, we have to look at it, but then of course also find ways, and there is no silver bullet, that's clear already. We really have to work with very different stakeholders and find individual solutions to make it safer for the communities, for the people, for everyone. And that's what we are there for as the International Alliance, help to find those individual customized solutions, also support governments. And the governments, I don't think at this point any government, if when the next pandemic comes, or the next epidemic, will want to say, well, we just ignored what we should have learned from the COVID-19 pandemic. I think it would. I think it's in everybody's interest to make an effort and try to reduce the risk. There is no complete prevention, but there is definitely ways in preventing and reducing the risk considerably. And I think we have a collective responsibility also trying to do that, because what we do as individuals does affect or can affect the entire world if under certain circumstances. So that is incredibly important, and working together towards such a joint goal. One thing that I do want to stress particularly here, though, is that the solutions that we're looking at, we are looking for solutions that do preserve biodiversity as well as protect health. So these are the kinds of solutions that we want to see. We want to have win-win, or multiple or multi-solving approaches towards that, protecting biodiversity, protecting wildlife, but of course also recognizing and respecting local community needs, people who do depend on wildlife protein, etc. We are addressing mostly the commercial trade and consumption of wildlife, particularly when the commercial trade in urban areas that is on the rise, and in many places around the world. There is an increasing, there are increasing consumption patterns around the world. There is more and more wildlife that's being traded and consumed, and with it are the risks are also increasing. So that's something that we want to look at, and maybe I'll leave it at that.
Yeah, thanks, Kim. That was a lot. That was great. Thank you so much. I'm gonna keep